This is Frontline host Ryan Stanton. Before we get into today's episode, I wanted to invite all of our listeners to join me in Chicago this October for the 2026 ACEP Scientific Assembly. Alone, we each take care of our patients, but together, we can change the face of emergency medicine. Join me and thousands of your colleagues for ACEP 26. Register now at acep.org/ACEP26 and get free access to ACEP anytime. We'll see you in Chicago. Ryan Stanton here with ACEP Frontline. Today here at LAC, Washington, D.C., talking with Brad Fitch, and he's going to come give us some pointers. So the one non-physician that we've talked to today, but somebody in a background similar to mine with the history in radio and TV as reporter and writer and all of those things, but now very active here in Washington, D.C. So first and foremost, thank you for joining me.
Thank you for inviting me, Ryan.
Appreciate you being here and helping out our physicians. And first and foremost, let's get into who you are. So give us a little background. You're a CEO. You've written books. Tell us a little bit about yourself.
I've been one of these fortunate people that was able to work in and around the United States Congress for 4 decades. I was one of those kids that came from a little town in upstate New York and did the 8th grade school trip thing and really fell in love with government and history and politics. And so I came here right after I graduated and went to graduate school here, and then just stayed around Congress, first as a reporter, then as a staffer, then as a consultant working with the United States Congress for 20 years with the Congressional Management Foundation, which is kind of like the small business consultant for those congressional offices. So I was able to get in some writing there and work with just wonderful members of Congress and staffers for almost 20 years, and 14 as CEO. And about a year and a half ago, I'm going to slow down a little bit, semi-retired, so more writing, some consulting, more dog walks.
I love it. And then tell me about the book that you have available.
Yeah, starting in 2008 and 2009, I had just collected all these stories and information related to how people interact with the United States Congress and was able to turn it into a book called Citizens Handbook for Influencing Elected Officials. And half the book is how Congress really works, and the other half is how to influence it, because the first half I want to convince them that your voice does make a difference, and that most members of Congress, nearly all of them, are really decent public servants that want to listen to their constituents, understand how an issue affects them, and then make a good decision. And then the second half is the how of how to have a meeting, how to use social media, how to advocate back home in the district or state. And got lucky that right when I retired, the book needed a second edition, and the publisher came to me, and so the second edition was published in November of 2025. Twice the size. It was a lot of fun to go back and focus groups and interviews again with staffers and members to see if anything had changed in the 15 years since I'd written the first edition. And lo and behold, not much had. Frankly, members were still motivated by constituents. Staff are still very young. The average age of a legislative assistant in the House of Representatives is 27 years old. But it's the best and brightest. I mean, it was a great place to be young, and it's an exciting work environment. It's gotten a little harder in the last 10 years, especially after both anthrax in 2001, and then, we still live in a post-January 6th environment on Capitol Hill. I mean, the community is still scarred by that, and so that memory just doesn't go away. So it is a little harder, but there's still dedicated young people who are working as staff and members to this day. Most of them are really good-hearted people.
All right, so let's get a little bit into that communication, because you've seen it from both sides. The interviews that you've done, interviewing these people, but also being involved on that political side and seeing how people interact with them. Kind of dive into some of those things that you saw, and we'll do some of the do's and we'll do some of the don'ts, and kind of get a little bit of both. I did talk to 2 state representatives earlier, as well as somebody who served as a health fellow within the Senate. And that was one of the questions I asked them, like, what are the immediate turn-ons and what are the immediate turn-offs for your job there? So let's get from your standpoint some of those do's and don'ts.
Well, first, we got to tackle the myth up front that your voice doesn't make a difference and that everything is either rigged or run by leadership. And there are certainly issues that I call either reputational or electoral issues. And right now it's guns, immigration, and abortion. When I worked for a United States Senator, sometimes we'd say, this is a eulogy vote, Senator. They're going to talk about this at your funeral. That's how important this vote is. Excuse me. But most issues aren't like that. Most 96% of what the Congress is dealing with are what we might call niche issues. Now, if you're seeking more funding for Alzheimer's research because your grandparent has dementia, that's really important to you, but that's not going to determine the next outcome of the election for that member of Congress. So they have more flexibility to support you. So starting there, that kind of busts up that myth that it's all rigged and that members of Congress are just going to foul leadership. And sometimes, on really important tax bills, sometimes on health care, we saw it happen in 2010 and 11. We saw a movement against the Affordable Care Act. In 2019, we saw it in favor of the Affordable Care Act. So, the Democrats lost in 2010, the Republicans lost in 2018. So sometimes, healthcare does become an electoral issue that does affect elections. But most of the issues on healthcare are dealing with such a small segment of a society, whether it's a patient advocacy group or a doctor's group, a medical professional group, that they have flexibility to support you. In the do's and don'ts, the do's are do research on the member of Congress, know a little bit about them. Maybe they've taken a position on your issue in the past. Maybe they've given a speech. The internet makes it a lot easier to research that, and AI makes it even easier to find out whether a lawmaker has made any statement related to your issue. So be prepared when you go in and talk to that lawmaker. You never want to be angry, or you can be emotional, and that's okay. You want to bring emotion to the room because most of these meetings are really boring. And so if you're bringing some interesting story about something that happened in your emergency department or happened to some of your colleagues in the department, they're going to listen intently to that because they want to understand the human impact of the policy decisions that they're going to be making. So bring that human story and be ready to be a storyteller. The research on the neuroscience and psychology of persuasion is actually very clear. One neuroscientist said it this way. He said, we like to think of ourselves as thinking beings, when in reality, we are not thinking beings. We are emotional beings that occasionally think. And that is just time and time again, studies have shown that if you bring an emotional story to the room, whether it's advocacy, whether it's seeking charitable contributions, if you're a nonprofit organization, that's what people are going to listen to. And members of Congress are, frankly, real people, just like everybody else, and they're going to be listening for that story and want to understand the human impact.
So that was the rant is one of them that they brought up. The stories, of course, the relatable stories, is one that they brought up as well. And I think that's one of the challenges as physicians is coming in and trying to, relatively either rant or preach to the policymaker. As physicians, we're used to we're in our kind of fiefdom that is our department. Everything kind of revolves around the decisions we make and the things we say, and we kind of feel like. And one of the biggest challenges for physicians going to either a state capitol or here in Washington D.C. is the fact we want things to run like science.
Yeah.
If I show you the evidence, I want that to be the outcome. If I say 1 + 1 = 2. I want that to be the case. I don't want it to be 1 + 1 = house cat, which is a lot of times what it feels like in Washington. Being in an environment like this with emergency physicians, kind of tailor that message to say, this is the environment you're going into, and this is how what you do can translate to these people that are trying to listen and understand what you do.
Well, and I get that, and when I talk to physician groups, they often are disappointed that everything isn't ruled by facts, and there are facts now that are, frankly, having a very important role in decision making, because we have seen, let's just say, what the elephant in the room is. The tax bill that was passed in 2025 by the Republicans and Trump administration is going to impact rural hospitals. And that's a reality that members of Congress are getting acutely educated on by physicians and hospital administrators. And that's a really good thing that they're seeing the consequence of their decisions. They're hearing from state legislators right now that are calling and saying, we have to now make up these budget cuts that you put in place. And that means we're going to be providing less services at the state level in certain areas. So bringing the argument and bringing the facts into the room, especially the local facts, that does make a huge difference to these lawmakers, because right now we live in such a consequential time when it comes to healthcare, an unusual time when it comes to healthcare. It's not 2009 anymore, right? We've now had the Affordable Care Act for a decade, and we've seen the impact, and we're starting to feel the impact of health insurance premiums go up and hospitals being affected. So bring that data into the room So the lawmaker knows in no uncertain terms the impact of policy decisions on a local community. But having that personal story as well, whether you're talking about violence in the workplace, I educated myself when I was talking to the Emergency Nurses Association, and I did not know one of the most dangerous places to work in America is, either catching fish in Alaska or an emergency department. And I'm like, whoa, who knew? And I guess that I think staffers will have that same reaction when you start talking about what happens when you're dealing with a boarding crisis that results in many patients being in an emergency department for 24 hours. The impact that has on the staff and on the patient and on the patient care. They're going to want to hear that story and tangibly feel that issue and be descriptive. It's okay. When I was talking to the nurses, one of the constituents had a picture of a friend of hers who had been beaten up. And she had a picture, this woman had bruises on her face. And she's like, should I show this photograph to my member of Congress? I said, hell yeah. That's a real life experience of someone who was terribly affected by having an unsafe work environment. So I think those personal stories are really valuable, and I get that bringing in the facts are really important, and especially since policymakers are making many decisions these days with, frankly, not really understanding the long-term implications that could be happening. Healthcare is one of those issues that is driven a little bit more by ideology than most of us are comfortable with. Taxes are another one. Guns, abortion; those are issues that are ideologically driven. But then some of the healthcare issues are not ideologically driven. They're driven by the facts on the ground. And so having good facts and bringing them into the meeting with that lawmaker or that staff member is very important.
You mentioned, the physicians coming in telling the story. I mean, of course, I've told the stories about the injuries and assaults and things that have happened to me in the emergency department. But I think there's the opportunity to come in and that impression, and the example I'm going to give is the fact that, when I've come up here, I've only met, in the 15 years I've come up here, I've met with Mitch McConnell, representing me as a senator in Kentucky once, and that was just for a picture in his office at the Capitol, and then to the staffer. And I think a lot of the physicians and folks kind of get down when you end up talking to a staffer, because a lot of, especially me now, they're just barely older than my children. Yeah. But I find that they're just incredibly intelligent and invested, and some of them, the feeling out of where they are in the healthcare spectrum. Sure. Some are the ones in charge of the healthcare piece of legislation, and some of them are just stepping in to cover. What's some advice you can give for that communication and utilization of the staff members of the office if you're meeting with them rather than, say, the member? Sure.
Well, first, you deliver the same message. They're little politicos in their own rights as staffers. So you're not really going to have to alter the message much, because you want your data and your stories to be the same whether you're delivering it to a member of Congress or to a staff member. I always encourage people to follow up with an email afterwards to the staff member. You're going to get something really valuable, their business card. It'll have their email address, the office they work on, and they cover healthcare for the member of Congress. That is a valuable piece of data that is sold in Washington, D.C. for a fair amount of money. So you got that data. So it's always good to send a thank you note afterwards or a follow-up. If you have a handout, for example, that you have an electronic form in addition to paper form, that's always a good idea to follow up electronically, and so that staffer has it on file, because paper gets lost. And let's face it, this generation, they're Gen Z or young millennials, they're not paper people. Everything is on their phone and on their computers and their laptops. I remember doing a study once of email on Capitol Hill, and I went to meet with a legislative director friend of mine, and I said, I just want to look at your email inbox and how you manage it. And he had this subdirectory in Outlook called Important. I was like, ooh, what goes in there? And I went into it, and it was follow-up emails from constituents who had given more information. He said, I knew this vote was going to come up in a couple months. I just needed to save it, because then when the vote came up, I wanted to pull the data down from that lawmaker's constituents so I could tell the lawmaker, hey, I met with this group 2 months ago, and they sent me this handout. So having follow-ups are really very valuable. If you don't get a meeting with the member, the other advice I offer is meet with the staffer back in the district or state. I was dealing with a group, this was a hunger group, and in this particular case, and usually, the Washington staffer, the Senate legislative assistant, was being a little standoffish and not taking the meeting. And I always advise them, if you're having trouble with the Washington office, contact the state office. So this woman contacted the state office, got a state staffer on the phone. The state staffer started a text exchange with the legislative assistant in Washington. And the staffer in the state office said, this person is coming. She's with a food bank in our town. When will you meet with her? Not will you, when. And she's on that chain. So staffers back home often become champions for causes and for people because they know if they don't, they might run into them at the Little League game or at the grocery store or at the gym or something like that. So they don't want to have that uncomfortable meeting where they blew off a constituent and then suddenly saw them in the workplace. So if you have trouble, if you do have any trouble connecting with people in Washington, always remember that those staffers in this district or state are going to be as, if not more, responsive to a DC staffer.
All right, let's go back to a little bit of the oopsie daisies. With regard either to physicians or your experience in the 4 decades up here, what is the biggest mistake people make?
Well, the biggest mistake is, the most common, is just reading the national organization's talking points and just not giving a localized version, not personalizing it in some way. That is the most common error. And in surveys of congressional staff, they'll tell you that 7 out of 10 constituents that come in the door, that's what they do. And they just reading a talking point like robots and then leave. So the biggest mistake is not localizing it, not personalizing it. The second biggest mistake is only doing it once a year. Mm-hmm. You know, if you're interacting with a couple times a year, it really makes a difference. I was interviewing a staff member, and she said with a group that she knew and a constituent that she knew, she opened up her inbox on a Monday morning, and there was an email from this constituent talking about an upcoming fly-in, and the staffer said, "Ooh, I wanted to read that." Now, I don't know many of us wake up in the morning on a Monday and say, "Oh, I want to read my email." I mean, it's just not normal. Staffers are not normal. They're working very, very hard in very unusual work environment. But yeah, when they see that type of communication from somebody they know, they're going to gravitate towards that. They're going to respond to that one. Relationship building is the most important thing you can do, and it's the most valuable thing you can do. And keep in mind, this is not a thing you do once or twice a year. The average turnover of a House legislative assistant is 1.7 years. So even if you do develop a relationship with someone, they could be gone, or they could be the chief of staff. So keep that in mind, that the average tenure on Capitol Hill is 8 years. They're often moving between offices, so they might be a healthcare for another member of Congress. And then the other thing that people don't do is realize that some members are more powerful than others. They may sit on an important committee. A few years ago, the senator from Montana, who was chairman of the Health, Education, Labor, and Pensions Committee, got appointed to be the ambassador to China. So he was no longer chairman. So the new chairman was going to be from Oregon. And this healthcare group I was working with instantly went to their database and said, "Who knows Ron Wyden?" Because he's the new chairman. And one person said, "Oh, I know their legislative assistant." Okay, that healthcare professional just became the most powerful healthcare professional in America because she had a pre-existing relationship with a legislative assistant who was the new committee chairman that had jurisdiction over healthcare in the United States Senate. So not realizing that there is a hierarchy here. There's going to be a big possible power shift in 2027 if the Democrats take over the House of Representatives, right? If you're from Oklahoma and Oklahoma City, you've got a really good friend because the chairman of the committee is Tom Cole, and he's from Oklahoma City, and he can get money into Oklahoma City. If you are from New Haven, Connecticut, you're putting your odds on Rosa DeLauro because she's the ranking member and will be chairwoman again in 2027. So suddenly the power shifts from Oklahoma City to New Haven. So knowing who represents you and the committees that they're on is another valuable thing that you can do to increase your power level in Washington.
Oh, that's bonus nuggets right there.
Yeah.
And make sure you know who's and then that's been nice for us from a Kentucky standpoint.
Yeah.
In as much as whatever your belief and thoughts are on Mitch McConnell is the fact that he's probably been one of the most influential senators in this country's history.
Yeah.
And having him in that position and having those meetings and things like that has been very special for our state and the Commonwealth, a relatively small one. All right, so any closing thoughts? Kind of let's put a bow on it for today of messaging thoughts or anything I missed from the discussion you had earlier to our members as we head to Capitol Hill tomorrow.
Well, I guess my closing message I've said before, which is don't make this a one and done. Think about what you can do when your government relations staff reaches out to you, which they will sometime this year, whether it be an action alert that comes out asking you to take action. Please respond to that quickly. Things happen very fast on Capitol Hill. Committee hearings are scheduled without much notice. Bills come to the floor without much notice. The groups that act rapidly and get constituents engaged rapidly are the ones that are going to have a much greater influence on those policy outcomes.
And we see that with the state level as well. It's, especially with our state, it's like as soon as you see something come on, you better be ready because they're going to try to pass it. They're going to get in front of committee. They're going to try to pass it within like 48 hours. It's going to go really, really fast. So how can folks get in touch with you, find the book, those types of things?
Well, the book is referenced on my website, which is bradfordfitch.com. But the easiest thing is just go to Amazon and just, Google Citizens Handbook for Influencing Elected Officials. I'm really happy with this version. The second edition was twice as large as the first one. I mean, think about it. In 2010, I wasn't talking about social media or telephone town hall meetings. So it was a really fun labor of love to jump back into the content and get it out there into the marketplace of ideas. And, I hope people use it and realize that their voice does make a difference.
All right, talking with Brad Fitch. Appreciate everything and hope people check it out. Some things I've learned here today and we'll try to implement tomorrow. As Arvin Venkat, who's our a state representative out of Pennsylvania who was here this morning, he said the exact same thing of set a meeting every 6 months with your representative in their office, their home office, even if you have nothing to talk about. Just to set that up, that regular schedule, building that relationship, being there. I've got one of those with our House of Representative that represents our district, now running for Senate. We sit there and text back and forth all the time and take care of each other.
Wow, that's great.
And like to hang out and have a good time and share Kentucky stories. But I appreciate your time and being here with us at LAC.
Thank you, Ron.
All right, and as for me, you can contact me, rstant@acep.org, rstant@acep.org, and make sure that you're subscribed to the podcast on your favorite player. Share it with your friends, neighbors, whoever it may be, and send us a 5-star review. Until next time, I'm Dr. Ryan Stanton, and this has been some ACEP Frontline.
If you're not on the front lines, you're on the sidelines.
Cue the music.
Bow, bow, bow.
Ding. Quiet place, all
Yeah.
alone. Da, da, da.